Hi, welcome to part 4 of common foot conditions that I see in an everyday podiatry clinic. And today we're going to be looking at a subject that a lot of people will have experience with, unfortunately, and that is ingrown toenails, or to use its medical name, onychocryptosis. So, firstly, it's important to explain what an ingrown toenail is and what it isn't. When a piece of nail penetrates through the skin of the toe, usually into the sulcus, which is the cavity next to the nail where the skin meets it, it is not a curvature of the nail or an involution of the nail, although one can lead to the other. They are separate conditions. When there is sufficient cause for the nail to penetrate through into the skin, that we will see a sudden increase in pain. Often the toe will swell and be excruciatingly tender, it can throb, and that won't really settle until that spike of nail is removed. Ingrown toenails in particular are very prone to getting infected. That sulcus that I previously described, which is the area next to a channel next to the nail, pools and harbours bacteria and fungal infections as well, and so when the nail has penetrated into the skin, it can get infected very easily. Now, people who are most vulnerable to it are people who have hot, sweaty feet, who play a lot of sports, who wear shoes that are quite tight-fitting, or who pick at their feet, or people who have a natural inclination to an involuted nail. This is something that podiatrists see all the time with varying degrees of severity. Now, if it's mild, then you might just feel a kind of ouch and that you want to get that bit of nail out. If it's moderate, there will likely be infection set in and an increase in pain. And if it's quite severe and has gone on for some time, because the body automatically tries to continue to heal, it might produce something called hypergranulation tissue, which is a kind of red, very tender lump that comes up next to where in the skin, next to where the nail is penetrated. And that's a sign that the body is trying to heal, but it can't because the nail is actually in the way and preventing it. And so it just overproduces this excess tissue. On that first appointment, if at all possible, we'll always try and remove that spike of nail that's digging in, because that will give you immediate relief. And then we can shrink back or remove any of that hypergranulation tissue, that little red lump that forms, through various means. And then we would probably dress it, well, we definitely would dress it, and give you a treatment regime to follow until we see you next time. And on that next appointment, this is what I would do anyway, we'd be looking at the causes of why you've got the ingrown toenail and seeing if we can correct that. This condition in particular is very suitable for minor nail surgery that lots of us podiatrists do. It's a very simple, elegant procedure where you can have 1/2 or 1/6 or, a slither of the offending part of the nail permanently removed under local anaesthetic, and then a chemical called phenol, or sometimes other products, can be introduced into the nail bed to prevent it ever growing back, so you have a permanently narrower nail. So, in summary, ingrown toenails. If you've got one, get it seen by a podiatrist. It'll be worth your while. I've seen too many people who've been in pain for a long time, and quite unnecessarily. So it's one of those things to get sorted out sooner rather than later on your feet. Goodbye.